Hello, my name is Alexis Alvarez. This is case study 3 for SPCE 638, section 802. So just to review, the client that we are discussing is male, 2 years and 11 months old. He's the youngest. He has a diagnosis of autism and no other diagnoses. And the behaviors of concern that predicted his need for early intervention were limited communication, delayed cognitive skills, low social interest, and repetitive behavior. So, for training and support methodology, so in the position that I am currently in, I am in a supervisor position, but I am just RBT credentialed with a bachelor's degree. So the training and support that I can provide is to the technicians are BST and person-specific reinforcement. And so what this looks like is obviously the instruction, modeling, rehearsal, and feedback of BST. And that, as we know, looks different for each person. Some do better with just one note of feedback and they do it perfectly the next time, or they need a lot of modeling and then a lot of rehearsing. And so my turn, your turn, you show me, let's practice, let's do some hypotheticals. And so really the support that I'm able to provide is that individualized training to each technician where their skills need to grow. And then for this client specifically, we have to remember that he is 2 years and 11 months old. So he is still in a diaper and he is working on potty training. So the training that I need the technicians to know is how to properly change a diaper. And per our company's requirements to maintain assent during those times. Because as we know, diapering is not, and potty training is not a most preferred activity for a lot of our children, but to maintain assent, we go at their pace and we make sure that client dignity and respect is maintained. In addition to this client's young age, there's meal preparation and assisted feeding. So he cannot warm up his own mac and cheese, and he cannot yet blow on it to cool it himself. But we can show him first, we get the lunchbox, then we put it in the microwave. I touch the buttons, and then look, let's blow on it together. So that way he is immersed into it, his feeding in a way that's appropriate for his age. In addition, one of his deficits was limited communication. And so he has a PECS book with icons. And so this requires training to the staff of the proper way to implement PECS communication. Things like we always bring it with us. This is the way that he speaks to us. In addition to modeling that I want juice, I want this, let's play more. That just constant communication just to expose him to more of that. And then in addition, another one of his deficits was low social interest. And so we know that he does like to be around people, he likes to play, but initiating that play, initiating that engagement is difficult for him to do on his own. And so part of the training that I have the staff go through is how to contrive situations for play with adults and with peers, making sure that the child feels supported while we're there. And so that way we can build their confidence, build their skills to eventually do it on their own. For my company, there are a few different ways that we measure validity and integrity. So first, we speak on client integrity, and this is through the supervision that I provide. Again, like I mentioned, to maintain client dignity and client care, that's number one. So those demands of it's time to go potty, it's time to sit to eat, are still important while still maintaining assent. In addition, we measure treatment for our company requirements. So we use Central Reach, which is a software that we track our data on during the sessions. Our technicians go through the training of how to use Central Reach and how to navigate Central Reach, in addition to tracking the different procedures on there. like the prompts, physical prompts, verbal prompts, reading the instructions that the staff or the supervisors make on the side of CentralReach, if you're familiar. And then we supervisors have access to a company app that tracks staff specific data across 30 client treatment days. And so this way I can check in on that once a week or however many times I see fit to see, okay, which programs are not being run, and is there, certain staff who doesn't feel confident or comfortable running this procedure? Great. This allows me to see it more easily and then address that issue if there is one, or maybe just they have some questions and they haven't gotten a chance to ask me. Always just, giving them that grace of, hey, I'm not sure if you know, but let's do it together and let's see where the deficits are. And then to measure treatment integrity. So treatment integrity, as you remember, it's procedures, making sure procedures and protocols are being implemented correctly and tracked accurately. So again, from observation, I can see, oh, I think you hit gesture when you actually did a full physical, kind of being over their shoulder or logging into CentralReach at the same time during their session, so I can see their past treatment during the session. And then we also do IOA data collection. We usually do trial by trial for 15 minutes per our company requirements. And it's in the moment. And so it does kind of take a village of, hey, can you keep an eye on the client so I can really quick cover the IOA with this staff member. And then we go through and we talk about, okay, what data did we mark the same and what data do we not mark the same, and then we speak on it. So by allowing it to be 15 minutes, it's short, we can get a good amount of different skills like communication skills, cognitive skills, motor skills, and then see the data together. And then in addition, to measure treatment validity, so remember that would be the social significance to the client. So it's a discussion with the BCBA and any supervisor in charge of the client's case and the parents. What's important to them? What skills does this child need to learn? In addition to the assessment that the BCBA chooses and the age norms of the assessment, how socially significant the assessment is to the client. So that past slide was what I can do in my role as an RBT certified with the bachelor's degree supervisor in the company that I'm in. But I do know my company has tools to address suboptimal performance. And this could be, you're not hitting our company requirements for treatment delivery, or it could be something like, you seem to not be changing this client's diaper when it's full and it's leading to issues. Or it could be attendance or tardiness. So there's different levels that my company has, which is documented coaching, corrective feedback, corrective action, written warning, and final written warning. And before documented coaching, there is just that discussion of checking in or calling in is, hey, I noticed this. Is there something that you want to talk about, or any questions you have to make sure that how to change a diaper? Maybe that's the barrier of why you're not. Or oh, hey, I know lunchtime can get kind of hectic, but please make sure that you are involving the client in preparation of the lunch and feeding himself. Teach him how to feed himself with a spoon. Especially if it's part of his protocol, but it's also part of the childcare that we provide. So even for documented coaching, there is just that open discussion and that calling in and having the technician be aware that, we're aware that there's something that needs fixed. And then, so moving forward, like I mentioned, in my current position, my abilities are to supervise, provide BST, observe, and provide feedback and reinforcement. And then when I am promoted, the above tools are what I would be trained on, which leads us to our last slide for the future. So once I pass the BCBA exam and get promoted, I would have a different role, and there's different expectations of me, which would be to be trained on the company tools to address suboptimal performance, as per the last slide, and to use them as appropriate. And obviously, I would still seek guidance from my fellow BCBA and clinic director of how to go about that. But yeah, so that is the presentation. Thank you so much for watching.